in. So when we get to the question and answer session, please make it very brisk and make the questions pointed in a manner that they will be answered briskly as well. So we'll quickly roll into the program proper by inviting the chairman of the Presidential Task Force to please make his remarks, after which we take technical briefings, updates, and then we'll take your questions before the responses come in. Mr. Chairman, sir.
Members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, once more, our sincere apologies for starting this briefing at this light. We had a whole day of very intense discussions on the stage at which we are now in our national response. So thank you, our colleagues here of the fourth realm, for your understanding. However, let me welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Monday, 10th August 2020. On Thursday, 6th August 2020, the Presidential Task Force intimated Nigerians with a new direction of further easing the lockdown in our national response to COVID-19 pandemic. As we progress in this new phase of the eased lockdown, continual monitoring of global and national science and data remains the basis for strengthening our efforts to contain the virus. Key sectors that the Presidential Task Force will be watching, in addition to general level of compliance, are the education and transportation sectors. Schools are gradually reopening with the commencement of preparations for critical examinations. Guidelines have already been issued by the Federal Ministry of Education to all stakeholders. For the transportation sector, the Presidential Task Force continues to follow the developments in the railway and air transportation, respectively. Nigerians and sector stakeholders are admonished to ensure compliance with the various non-pharmaceutical measures already in place. The Presidential Task Force and the Federal Ministry of Aviation are working rapidly towards reopening of the international airspace to allow for international flights. The Presidential Task Force would also be looking closely at the issue of risk communication and community engagement. Messaging and consultations shall be intensified to drive the level of awareness and compliance to the wider population using mediums and platforms that are most effective, generally and specifically. Today, the global numbers of confirmed cases surpass 20 million. And there's a record of over 750,000 deaths. These statistics remain serious warning signals, accompanied with pains and anguish to families and friends that have lost loved ones. Africa's confirmed cases have surpassed the 1 million mark, which is a landmark. The challenge, however, is that the true numbers could be higher, because we suspect strongly that for every reported case, up to 7 might have been missed. Ladies and gentlemen, the numbers are surging. Community spread has taken root and expanded beyond the urban areas. Now we have infections right into the rural communities and localized areas. The watchword is vigilance and taking extra care. Nigeria today has 46,577 confirmed cases and 945 cumulative deaths. And that remains respectively the third and the fourth highest in these parameters on the continent of Africa. As we emphasized at the last briefing, Nigeria is yet to reach the peak of the pandemic. Therefore, the low test case confirmation numbers coming out daily should not be misinterpreted to mean that we have overcome this virus. We have over time ramped up testing, but more needs to be done to raise the quantum of tests per million. Our analysis has, however, shown that 5 states of the 36 states and the Federal Capital Territory, only 5, still account for 60% of cumulative cases nationwide. 2, 689 out of the 774 local governments as of today have reported a case. Therefore, 3, there are only 85 local governments in 20 states still have not reported any case or tested positive. And 4, 50% of all the cases are in 20 local governments. This statistics and information is important so that we can now understand the prevalence and the generality of the spread of the coronavirus in our communities. As of today, we have only 85 local governments out of the 774 that have not reported a case of COVID-19. Going by the surge and the growth in our figures, I do not rule out the possibility that very soon all the 774 local governments in Nigeria will report a case or two of COVID-19. The PTF is happy to note that many survivors are telling their stories and sharing them in the social media. The stories of those who doubted the existence of the virus and became unfortunately infected are now expressing appreciation for timely intervention of the case management team. That provides a compelling proof that the virus is real. I'm also happy to note that the electronic media has taken up our challenge of joining the risk communication as depicted over the weekend with the face-to-face interview conducted by the Arise News team, ably led by Amaka Ode. We thank the management of Arise News for the privilege of really promoting the experiences and the truth and the factual depiction of people who have been infected and who are still undergoing care in the National Hospital. We hope that other news medias will take up that challenge and go ahead so that we can drive this message home that COVID-19 is real, is still around with us, and people we know are going through the processes of recovery or receiving management care in our different facilities. It is also important I inform you that Nigeria continues to play its role in supporting the fight against COVID-19 on the West African sub-region. Last week, men and women of the Nigeria Air Force distributed PPEs and medical supplies donated by the West African Health Organization and other partners to our neighbors in the West African sub-region. However, to show true leadership against the pandemic, we as a people and country need to contain the virus by doing all we can to protect ourselves, our loved ones, and the country at large. I now have the singular honor and privilege to call on the Honorable Minister of Health, thereafter the DG or his representative of the Nigeria Center for Disease Control, and the National Coordinator to give us their updates and briefs. I thank you once more for your attention and have a very pleasant and good evening. Thank you.
Good afternoon, everybody. The Chair of the Presidential Task Force on COVID-19, honorable ministers here present, the National Coordinator, permanent secretaries, directors. As of 10th of August 2020, we have recorded 46,577 cases from 317,496 samples tested so far, while 33,186 persons have been treated and discharged. Sadly, 945 persons have been lost to COVID-19 infection, which has now been identified in 549 of our 774 local government areas. Half of all cases in Nigeria so far, over half, are concentrated in 20 local government areas, which could offer the attractive option of targeted attention to focus on case finding and isolation and treatment. The figures show that Nigeria is also sadly approaching the symbolic 1,000 number of fatalities, a grim reality that should be a wake-up call to all of us. Many more Nigerians today would have personally known a person who succumbed to COVID-19. And so I ask that we remind ourselves that COVID-19 is still with us and will be with us for a while. Until there is a vaccine, the only options we have to protect ourselves are still the non-pharmaceutical measures that are proven to be cheap and effective, such as the appropriate use of face masks, physical distancing, and avoiding crowds. If we do not adhere, there will be regrets. And the urgency is accentuated by the need to prepare for societal changes that will arise as the economy reopens with increased transportation, trade, human interaction, and even the option and possibility of reopened air travel internationally. We must make an effort to balance the benefits of a reactivated economy and not lose the gains made so far. Since Friday, the 7th of August 2020, we joined the rest of the world to commemorate what is known as the World Mask Week, the aim of which is to reinforce the importance of wearing masks to reduce the risk of spread of COVID-19 in the absence of a vaccine. Our focus is still to reduce fatality to less than 1%, not only with preventive measures, but also with a strategy that encourages citizens to report early for treatment and for hospitals to attend to all patients in distress. Most importantly, to be able to provide oxygen treatment. The main COVID-19 symptoms include breathlessness, which responds well to oxygen supplementation as a first measure. We are turning our preference, therefore, to gadgets that provide oxygen, like oxygen generators, to be in many facilities, including general hospitals and larger primary healthcare centers. Solar-powered aggregates, where available, will be prioritized. Federal health institutions with oxygen plants should activate them as a matter of priority and ensure they can deliver to their A&E departments. The other measure is the activation of ambulance service to move patients to treatment centers. This strategy worked well in Kano, and all states should prepare to set up the system. The Federal Ministry of Health will provide guidance and support and training. The National Council on Health, which is the highest policy-making body on matters relating to health in Nigeria, held a virtual emergency meeting on Thursday, the 6th of August 2020, during which the revised guidelines for the administration, disbursement, and monitoring of the Basic Healthcare Provision Fund, also called BHCPF Guidelines 2020, was approved. With this document, implementation of the Basic Healthcare Provision Fund, which was suspended in January to correct anomalies in the 2018 operation plan, has now resumed, and the process of disbursing fund has also started, right on time to support much needed state efforts in their COVID-19 response. The new BHCPF has much better country ownership structure and offers a much improved benefit package and a more robust fiduciary control for transparency and accountability. Development partners are invited to support the new revitalized plan in whatever manner they desire. We have made preparation to accommodate the varying programs and interests of our partners. The Ministry of Health is available to discuss and address the concerns and wishes of potential donors and users. The continuity of normal health services, capacity building of health workers, and their protection with PPEs are the most critical activities that we will wish to see secured. Resilient health systems ensure that Basic Healthcare Provision Fund services continue to reach PHC health facilities, which can be both public and private, and referral cases are sent to secondary healthcare facilities. It is critical in our present COVID-19 pandemic challenge to use the opportunity to strengthen our health systems. I also call on state, local government authorities, and healthcare workers to ensure the most rational and judicious use is made of all commodities provided. The National Council on Health also approved the establishment of the National Emergency Medical Service and Ambulance System, NEMSAS, an innovative system to pool the assets of public and private sector ambulances and hospitals, and also to raise funds to augment government seed money, to work with states to provide emergency medical care and patient transportation to all citizens whenever and wherever it is required, and irrespective of immediate or potential ability to pay. It will be possible to considerably reduce COVID-19 mortality and also reduce maternal and child mortality and post-crash mortality with a functional emergency medical service and ambulance system that can rely on the combined assets and efforts of private and public sector hospitals. It was my pleasure to receive the new leadership of the Nigerian Medical Association, headed by Professor Uja, on Friday, the 7th of August. And the visit offers the opportunity to re-engage the association for collaboration in addressing challenges in the health sector. We shall continue to value the input of our colleagues and also of all our frontline health workers as we move forward. I thank you all for your attention.
Gentlemen of the press, before the representative of the DGNCDC takes the podium, let me just introduce her to you. She's Mrs. Ilori. She's standing in, she's a director in the NCDC, and she's standing in for the Director General. Mrs. Ilori.
Chairman, sir, the ministers, DJs, members of the press, ladies and gentlemen, like I said, I'm standing in for my DG, Dr. Chikwe Ihekwazu. And today, we're going to focus on the wearing of masks. Like the Minister of Health said, we're joining the world to commemorate the World Mask Week. And as the number of COVID cases increases globally, this brings to the forefront the need to adhere to preventive measures. Therefore, wearing of masks is a key aspect of these preventive measures, and several studies have shown that its effectiveness in reducing the risk of infection. Wearing a mask in public, you not only protect yourself, but you also protect others around you. This is important because not many people will show symptoms. And some people you come across will not show symptoms. These are the people we call asymptomatic. They won't show symptoms, but they have the virus and they can transmit. But unfortunately, we have those that will show symptoms, and they are the vulnerable ones amongst us. And when they get sick, the possibility of being very fatal and dying at the end is there. So this is evident in our data. We are now closer to 1,000 fatality for COVID. This situation is not unique to Nigeria. It's a global issue, and it requires collective efforts. This is the 8th month since the world has been heavily impacted by this disease. And by doing our own bit, we can go through it much faster and making it, breaking the transmission. Doing our own bits means taking responsibilities and adhering to preventive measures on COVID, as well as emphasizing on the need for it within our family members and friends. When going out, wear a mask, especially when you are in a situation where physical distancing might not be possible, and that includes maybe in public transport or in the marketplaces. Face masks should never be shared. This is very important. You can use improvised masks. It's cost-effective, and we can wash it. I'm sure most of us are wearing that now. But the medical mask should not be reused. Please, it should be disposed of, and it should be disposed of properly in the waste bin. And let's wear our face masks properly, please. Under the chin is not effective. Also below the nose, we see some people wear it below the nose. That is not effective. You're not protecting yourself. You might be covering your mouth, but you're also taking in the air. So you need to cover your nose and mouth. That is when it is effective. When we are speaking, we should not put it under our chin because we are infecting it. If we want to speak, you wear it. Amplify your voice so that you can be heard. I think this will even help us with our singing, because when we amplify our voices, that helps us for those that are in the choir. Yes. Well, mask is an additional layer of protection when in public. However, the purpose is defeated when personal hygiene is poor and preventive measures are not being adhered to. Other preventive measures, such as avoiding large gatherings, frequently washing our hands, maintaining physical distancing, also are important. Join our social media campaign. We have a social media campaign which says #MaskOnNaija. So let's be responsible. Let's take responsibility and fight COVID within what is within our own control. Thank you.
The chairman of the Presidential Task Force, honorable ministers, members of the PTF, gentlemen of the press, good evening. Last week, I spoke on the eased lockdown guidelines. Today, I'll be reiterating parts of the protocol again so that people can be reminded. Before I do that, I just wanted to emphasize the fact that the PTF continues to drive the fight against COVID-19 based on a very scientific approach that's data-driven. Every part of our protocol is carefully considered, is carefully discussed at the PTF, and we also look at the scientific basis before rolling it out. And there's no doubt that COVID continues to be with us. For those who continue to deny the existence of COVID, I would say that close to 20 million people cannot be wrong. We have about 730 deaths worldwide. And indeed, it continues to be a threat to our way of life. We encourage persons above the age of 60 and those with an underlying medical illness to continue to keep away from the general public and to preferably stay at home. As stated at the last press briefing on Thursday, the eased lockdown phase 2 has been extended by 4 weeks from the 6th of August to the 5th of September. In terms of the various aspects of the protocols, the ones that I would like to re-emphasize are general movements. So the nationwide curfew remains from 10 p.m. to 4 a.m. We continue to have restrictions on mass gatherings and the security agencies have been encouraged and asked to continue to take actions against repeated violations, and we will continue to do so in the interest of public health. Movement of people across state borders as well as goods will continue, but only outside the curfew hours. We have been working closely with the aviation and port health authorities over the last few days, and we are confident that we will start the process of opening our international airports as soon as possible, while domestic flights continue to be in operation. Transport services must maintain all non-pharmaceutical interventions and ensure appropriate PPEs for all healthcare workers. We are linking up with the Federal Road Safety Commission to ensure that the guidelines they have developed are enforced within the public sector side. For markets and restaurants, I would like to emphasize the need for mandatory non-pharmaceutical interventions, particularly the use of face masks. Restaurants are advised that they can only operate take-out services unless those restaurants are part of hotel accommodation. As mentioned earlier by the chairman, conditional opening for exit students in terms of schools has already commenced. Banks are now operating regular hours with limitation of their staff to 75% capacity. We urge banks to please accommodate those that are elderly, people who are living with disabilities, and customers that do not have access to internet services, and prioritize them. The policy of no mask, no entry, no mask, no service must be followed. For government offices, we have started operating full services Monday to Friday, full-time, but only for civil servants grade level 12 and above. Hotels remain open, and we have removed restrictions on non-contact communal sports that are outdoors, but bars, gyms, cinemas, clubs, and event centers must remain closed. COVID is a silent enemy. It is an enemy that we cannot see with our naked eyes. Because of that, it's difficult to understand the extent of the risk we face. Behavioral change in itself requires a discipline. It also requires visibility in terms of the risks that we are facing. But we can only get on top of the COVID pandemic by continuing to work together and have an enhanced self-awareness of our environment and the need to abide by non-pharmaceutical interventions. The PTF urges all Nigerians to take the guidelines seriously. These guidelines can be found on the PTF website and will be published on all social media platforms as well as newspapers. We all have a part to play in ensuring adherence. We certainly cannot win this fight against coronavirus alone. We have to do it collectively. We may have escaped the worst. We are pleased that the numbers are starting to stabilize, although this is a reflection also of the testing we're doing, but we know that the positivity rates are gradually coming down. Therefore, let us please persevere. This is not the time for complacency. Let us live, let us survive, and let us remain safe. Thank you.
Honorable Minister of Environment.
Mr. Chairman, members of the PTF, distinguished ladies and gentlemen of the press, ladies and gentlemen from the Federal Minister of Environment, an update on the conclusion of our decontamination and disinfection exercise of the examination centers. The Federal Ministry undertook the exercise along with environmental health officers, licensed environmental health officers, which was completed on Thursday in all the 36 states of the Federation and FCT. We have also established surveillance desks at all of these centers, and these desks are being manned by 40,000 environmental health officers volunteers that we recruited, who are there on hand to provide guidance in maintaining the protocol of COVID-19 containment. They are there to provide any assistance, and they also have PPE just in case somebody will start to present symptoms of the disease. They will be there to quickly isolate and evacuate. Also, there will be a daily decontamination of the examination halls, and we are still calling on parents to advise their children to be of good behavior and observe all the guidelines that will be stated there by the officials manning the centers. And these guidelines still remain: wearing of masks, washing of hands, use of sanitizers, observing the physical distances that have been provided by the officials there. I want parents to know that all these are being done to safeguard the health and lives of our children. The federal government, through the PTF, under the directives of Mr. President, is doing everything humanly possible to make sure that we contain the spread of this virus. Our next big exercise, which we'll call exercise part 2, will come when schools open for conventional lessons nationwide. Jama'a assalamu alaikum. Za mu ɗan ƙara muku matashiya ne akan ayyukan da muka yi na tsaftacewa da feshe ɗakunan jarabawa da yanzu haka yara suke yin darasi domin ɗaukan jarabawan fita daga matakin firamare aji 6 zuwa ƙaramar sakandare, masu fita zuwa aji 3 har da kuma masu fita daga babban sakandare na aji 3. Mun riga mun gama feshe dukkan waɗannan gurare, mun tsaftace su, kuma mun samu shugabannin lafiya matsuguni a waɗannan gurare duka domin tabbatar da suna ƙara faɗakar da yara da malamai da suke gurin saboda ɗaukan wannan jarabawar, domin su ci gaba da bin ƙa'idojin da ya kamata. Wayannan malaman lafiyan kuwa akwai wajen 40,000 waɗanda duk mun raba su a wuraren da ake wannan jarabawa a dukkan jihohin ƙasar nan guda 36 da babban birnin ƙasa. Kuma a kulliyomin, in Allah yadda, za a riƙa feshewa ana tsaftace duk ɗakunan da ake ɗaukan jarabawa a kowace makaranta da ake ɗaukan wannan jarabawan. Har ila yau muna kira ga iyaye su ƙara jan hankalin 'ya'yansu, su ba su shawara su kasance masu da'a da bin umarni. Kuma har yanzu dai abubuwan da ya kamata a yi shine sa wannan takunkumi saboda kare lafiyanka da kuma na ɗan uwanka. Har yanzu maganan wanke hannu ko shafa wannan sinadari da ke kashe ƙwayoyin cuta, da kuma tabbata tazara wajen mu'amala wanda an riga an tsara a wannan guri. Kuma ina ƙara tabbatar ma da iyaye da 'yan Najeriya, gwamnatin ƙasa ta hanyar wannan kwamiti mai kula da daƙile cutar corona da ke aiki bisa ga umarnin shugaban ƙasa, da tabbatar da cewa duk inda ɗan Najeriya yake, mun yi yunƙurin duk abin da za mu yi mu tabbatar mun yi ayyuka, mun kuma fitar da ƙa'idoji yanda za a bi domin kare lafiya da kuma rayukan 'yan Najeriya. Abin da za mu yi nan gaba idan aka gama ɗaukan wannan jarabawa, wanda shine mataki na 2, idan aka buɗe makarantu duka a gaba ɗaya a ƙasa, in Allah yadda su ma ɗin za mu ɗauki nauyi ta ma'aikatan muhalli domin mu tabbatar da an feshe an tsabtace waɗannan makarantu har ila yau don tabbatar da kare lafiyan yaranmu. Assalamu alaikum.
Thank you very much, Honorable Minister, Environment. We'll take the questions now. Please take heed of the appeal. Let's just go straight to the questions so that we can conclude this proceeding very fast. Thank you.
Good evening, members of the PTF. My name is Friday Okerigbe. I'm a reporter with Channels TV. I'd like to direct my first question to the National Coordinator. It has to do with the developments during the weekend at the flag-off of the rallies in Edo State and also the burial of Senator Buruji. We noticed that all the guidelines regarding the safety protocols were all flouted. None of them were kept with. We know that many times when we bring this to the PTF, there's always this little challenge as to how the PTF will ensure enforcement. And we've been told many times that it is the responsibility of the states to actually do that. But my question is the PTF actually handicapped? Since we know that many states are flouting these rules, is there nothing that the PTF can actually do to ensure that states will take these protocols that are read out every day seriously and enforce them? Is there nothing that PTF can actually do? The second question, I would like to direct it to the NCDC or the Minister of Health. Either of them can actually take it. It has to do with the guidelines for handling the corpse of victims to COVID-19. It seems unclear, so we need clarification. What is actually the guideline? Are corpses released to family members for burial? I do know that during the Ebola period, because of the nature of the disease, the state took responsibility for burying those who fell victim to that disease. And also the COVID-19, in some countries, states are responsible for burying the disease just to manage the spread of it. What is our own policy here? Because we've seen in many instances, family members are the ones burying the corpse and violations to the protocols. Thank you.
Good evening, all. Rachel Abuja from the News Agency of Nigeria. My first question is to the Minister of Environment. So, with the increasing use of chemical for decontamination of places across the country, maybe some repeatedly, have we done an environmental impact assessment on the places that we go to decontaminate, on those locations, especially on the microbiota of these locations, to see how much impact on the short and long term of microbial ecosystem? Thank you. My next question is to the Minister of Health. Sir, as at last month, health workers in Nigeria constitute 5% of COVID-19 infection. Now, these health workers translate to about 1 in every 6 frontliners. How can we scale down on this in view of the implication of our response to COVID-19? Now, my last question is for Dr. Olori. I don't know why Nigeria is still making use of oral pharyngeal swab stick when report shows that the virus is found even in greater numbers in infected person. I ask this in view of the extra cost for swab stick, manpower, and let's not forget the discomfort associated with taking samples. Now, Nigerians would also like to know what is happening with the validation of test kits as currently going on by the federal government. Thank you very much.
Mr. Chairman, members of the task force, my colleagues, good afternoon. My name is Nancy Oyedia Orom from AIT. I would like to start with the Minister of Health. So some time ago, there was a COVID-19 hazard allowance that was approved for frontline workers like the health workers and also support staff. When I mean support staff, like the ambulance drivers and so on. But there was a circular that came from the Ministry of Health altering that agreement, thereby leaving some of the categories of these people out of that agreement that was earlier reached, which has caused like a protest from these people. So I would like to know what you are doing to avert the strike that these people have claimed that they want to embark on. And secondly, why is there an alteration of that agreement? Secondly, to Mr. Chairman, sir. So over the weekend, I saw this report that the World Bank will be assisting Nigeria with about $114 million to assist Nigeria fight COVID-19. I would like to know how those funds will be channeled, especially in the health sector. And finally, still staying with you, Mr. Chairman. All right, some time ago, the Lagos State governor came up and said that they were closing down some of their isolation centers because the number of COVID-19 in that state was reducing. And we've also seen some states also have discharged all their COVID-19 patients. And yes, we see Nigerians are not adhering to these protocols, but ironically, our numbers are reducing. Can we say that we are defeating this virus? Thank you.
Good evening, members of the PTF. My name is Juliana Taiwo Obaloyen of the Sun newspapers. The coordinator, this is for you, please. What is the sense in civil servants from grade level 11 and below not resuming yet when the same set of people are going to places of worship and markets? Still for you, and probably the Minister of Education as well, for states where schools have resumed for people preparing for exiting exams, what are the feedback you are getting? We'd like to know in terms of compliance level. Thank you.
Good evening, Chairman and members of the PTF. My name is Mitaire Ikbeng. I report for the NTA. My question is for the representative of the NCDC. Your daily statistics, COVID-19 statistics for the 4th of August indicated more than 11,000 cases discharged in 24 hours. I am curious, like many Nigerians, to ask, how did we get to discharge so much in 24 hours when we did not report a corresponding number of that magnitude of positive cases? Were they all admitted into isolation in one day? And if there were cases that were managed at home, who managed them at home? And are we likely to witness another massive discharge of cases like that in 24 hours soon? For the Minister of Health, as a follow-up on the issue of hazard allowance, doctors in university teaching hospitals and medical centers in MDAs say they have not been paid COVID-19 hazard allowance, and they are asking when will they be paid. Thank you.
The Chairman, National Coordinator, members of the PTF, my colleagues. My name is Amaka Ode. I report for Arise News. And 2 quick questions. First, to the Minister of Environment. We need confirmation from you. There are reports that some private schools in the states, particularly I think Kogi and I think one other state in the southwest, they said they haven't been decontaminated. And today you told us that you've covered all schools. So are you only focusing on the government schools or are private schools involved in your decontamination? So we need that from you. And the Chairman, National Coordinator. Well, the Chairman today reeled out some troubling statistics as it concerns our COVID-19 cases in the country with high burden local government areas. And the PTF time and time again had spoken about precision lockdown on some of these high burden areas. Is this likely to happen anytime soon so that way we can contain the spread of the virus? Thank you.
Mr. Chairman, members of the PTF, my colleagues. My name is Mohammed Salih Nazif. I work for Voice of Nigeria. My question goes to Health Minister and the coordinator. The Health Minister, please. During this COVID-19, we have seen COVID patients with comorbidity receiving simultaneous treatment of both COVID and other health issues like hypertension, diabetes, cancer, and renal issues, which is very commendable. My question is, going forward, will your ministry advise government to subsidize the cost of treatment of these diseases through National Health Insurance Scheme, at least so that poor people can have access? Because
This is a network service of the NTA.